Once again, it's your boy Brad Scholar in the Scholar Media House. Yes, if you are new here, what to do on this channel is that we talk about social issues, we talk about trending news that are trending within the country, and then we talk about health conditions. Yes, we educate our subscribers in most of the medical conditions, and then we give health tips. Yes, so if you're new here, I will urge you to try as much as possible and hit on the subscription button to subscribe to this channel. Yes, today, since we are in the dry season, we deem it necessary that one of the medical conditions that is easily exacerbated or provoked by the weather or by the season is asthma. So our topic of discussion today is going to be on asthma. Yes, so please, as I've already informed you, we talk about health issues, we talk about social issues, and then we talk about trending news that are trending within the country. If you're the time that want to get information around all these topics that I've mentioned, try as much as possible and then hit on the subscription button, leave a comment below, and then like our video for us. Thank you very much. Let's stay tuned and then enjoy the video. When we talk about asthma, what at all is asthma? Like, you've been hearing of asthma. What at all is this asthma? Yes, when we talk about asthma is a chronic respiratory disease which is characterized by inflammation, airway obstruction, and the spasm of the bronchial tubes which carries air to the lungs. Yes, so asthma is an inflammation, airway obstruction, and spasm of the bronchial tubes which carries air to the lungs. And when this happens, it can lead to coughing, chest tightness, it can lead to wheezing, it can lead to shortness in breathing. Yes, so these are most of the symptoms that an asthmatic patient will be shown when they are having an attack. They'll be having wheezing sound, they'll be having shortness in breathing, chest tightness, and then they will be coughing. Yes, so these are the most of the symptoms that mostly asthmatic patients normally let me say demonstrate whenever they are having their attack. Yes, so here are the ways and means to prevent yourself from asthmatic attack if you're an asthmatic patient out there in this dry season. Dry season can exacerbate asthmatic attack due to low humidity and then increased particulate matter in the air we breathe nowadays. So if an asthmatic patient, you need to listen to me and then know how to prevent yourself. Below are the ways and means to prevent yourself from an asthmatic attack. Number one, you have to stay hydrated. Yes, stay hydrated. Drink a lot of water to keep the airway moist. Yes, stay hydrated. Drink a lot of water to keep the airway moist. That is the number one thing. And number two, avoid strong fragrances. Stay away from perfumes. Stay away from cleaning products or cleaning agents and strong smelling product that can easily trigger your asthmatic attack. So number two, stay away from what? Stay away from strong fragrance. So these fragrances include the perfumes, include the cleaning agent. Most of these cleaning agents are smell like they have high smelling, I don't know how to put it, but they are strong in such a way that they can easily trigger your asthmatic attack. So stay away from what you call like high fragrance. And then wear a mask. Wearing of a mask help you to filter the particulate matter in the air we breathe. So maybe if there are some particles or there are some other particles in the air we breathe that could easily get trapped in the bronchial tubes, when you wear the mask, they easily filter those particulate matter, which will prevent those particulate matter from getting trapped into your bronchial tubes, which will eventually trigger your asthmatic attack. Yes, so wear a mask. Number three, that's number three. The third thing is wear a mask. Number two, monitor the air quality. Monitor the air quality. When you are going out, you have to monitor the air quality index. Monitor to see whether there are some particulate matter in the air. It could be maybe smoke, it could be maybe dust in the air. If you realize that there are a lot of dust in the air, don't go out. Wait, be inside, and then do all these things to settle before you go out. Once you go out, this particulate matter could easily be trapped in the bronchial tubes, and when they are trapped there, you could experience the attack. So monitor the air quality whenever you are going out or wherever you are going somewhere. If you are somewhere, you are coming to the house, you are going out, you are going somewhere, and you realize that the air quality is not good for you, there are a lot of particles, there are a lot of particulate matter, there are a lot of, so just as I was saying, you just have to monitor what the air quality. Once you know there are a lot of dust or there are a lot of smoke, there are a lot of particulate matter in the air, don't go out, stay indoors until all those things settle before you go out. So number four, or the fifth thing to do is what? Avoid cold air. When you're an asthmatic patient, don't bath cold water, don't go out when the weather is cool, because it easily trigger your asthmatic attack. It's easily, because when the weather is cold, everybody find it difficult to breathe at times, and you are already having maybe, let me say, a constricted bronchial tube. So when it happens that you find it difficult to breathe, you are easily attacked by your asthmatic symptoms or asthmatic, so don't bath cold water, don't go out when the weather is cold. Yes, so to prevent any asthmatic attack, don't bath. If you're an asthmatic patient, don't bath cold water, don't go out when the weather is cold. And then maintain your asthma medications. You have to maintain your asthma medication. Take your prescribed asthma medication as directed, and if there is a need for you, contact a doctor if there is a need for you to adjust your asthmatic treatment plan. Maybe you realize that maybe you are taking, maybe there is a dosage given to you are taking, maybe it's not effective, or you are not seeing any sign, like any sign of improvement. You have to contact the doctor to see if there is, maybe they can adjust it for you so that the treatment can be ongoing and effective. So that is the little thing you can do as an asthmatic patient in this dry season to prevent any asthmatic attack. Now let's talk about management of an asthmatic patient in case somebody is having asthma, or somebody is having an asthmatic attack in front of you, a sister, it could be a sister, a brother, anybody at all, or even you having an asthmatic attack at that moment. What will you do? Or anybody around you, what could the person do? So if an asthmatic patient, share this video to a friend, a family member, anybody at all, so that in case you are having the attack, the person could. But just as I was saying, if you are an asthmatic patient, or if you know somebody who is having asthma or who is an asthmatic patient, share this video to the person so that the person will know the ways and means to prevent his or herself from asthmatic attack in this dry season. Yes, so just as I was saying, in case somebody is having asthmatic attack, the immediate first aid management to render to the person at that moment is very, very important, because the slide, if you waste a little time, in fact the condition could be complicated. So here are the ways and means, or the immediate first aid management needed at that moment. Yes, so the very first thing you need to do is that take away the trigger. What triggered the attack might be taken away from the person, or if it is possible, take the person away from what triggered the attack. So if maybe the person had the attack, or it was triggered by a perfume, that person should be moved away from the perfume, or the perfume should be moved away. So the trigger should be moved away as early as possible. And the second thing is you put the person in the sitting up position. You put the person in the sitting up position with the back being straight. If the person is in the sitting up position, it's how the person to breathe easily. It promotes breathing. At that point in time, the person find it difficult to breathe. So if you put the person, or you make the person to lie down, it's like still there will be breathing is not promoted. Like the person will still find it difficult to breathe. But if the person is in a sitting up position with the back being straight, it promotes breathing. So second, the third thing you need to do is that after doing all these things, you remove all tight clothing that are around, like the way mine is. It should be removed. Anything at all, any clothing that tied the person should be removed. Whether it's a tie, belt, everything should be removed, so that losing every tight clothing that will constrict the neck or the chest, and all these things doesn't promote breathing. So all those things should be removed. So after doing all these 4 things, the next thing to do is what you administer his or her medications. If it is the inhaler, you give it to the person. If there are some other medications that are prescribed, you give it to the person as early as possible. And after doing all these things that I've told you, including the medication, and the person is still experiencing the following things I'm about to mention, transport the person to the earliest hospital or the nearest hospital as early as possible. Understand? So the following thing that will prompt you that this condition is becoming complicated, or this condition is very, very severe, is the person will be having very severe difficulty in breathing after the medication has been delivered, and the person will having chest tightness and chest pain after the medication. Still, after you've carried on the following steps I've told you, and then giving the medication, still you are not seeing improvement. The person will be having very finding difficult in breathing. We'll still be having chest pain and chest tightness, and the person will be having blue tinted fingers and lips. The fingers will be blue, and then the lips will be finding. So that is one of the things that you have to know, that the condition is becoming complicated, the condition is worsening. And then the other thing to be that the person will be losing his or her consciousness, or be experiencing confusion. So if these things are present after carrying on the immediate first aid management, then the person needs to be transported to the hospital as early as possible. Yes, so these are the ways and means to manage someone with an asthmatic attack, the immediate first aid management needed for someone with an asthmatic attack. Yeah. So today this comes to the end of our video. So today here comes to the end of the video. We told you what asthma is. We told you the ways it means to prevent yourself from asthmatic attack when you are an asthmatic patient, and then we also told you how to manage someone with asthmatic attack. Immediate phase aid management needed for someone who is having an asthmatic attack. So if you find this video being helpful to you, try as much as possible and then hit on the subscription button and subscribe to this channel for us. Your subscription is very important to us. Your comments, your likes are very important to us. If you find something or you have something to say or you have a question to ask regards to this video or anything at all, just leave it under the comment section and I will find time and reply everything that is in the comment section. And if you think we can't reply you when we get to the hospital, we've talk to doctors or ask doctors and then we'll provide the appropriate answers for you. I'm just a nursing student, so most of the things I may not be able to answer them. So thank you very much for staying with us. We really appreciate your time, everything. In fact, keep supporting the media house, keep supporting the channel for us. We are doing this because of you, and then we'll be very glad if you can subscribe to the channel for us. Thank you very much. See you in our next video.